Hello everyone, my name is John Aranda and I'm a student physical therapist at the University of St. Augustine for Health Sciences at the San Marcos, California location. Today I will be discussing a topic about the intervention of dry needling for patients with neck pain. This topic became of interest to me as I was on my first clinical rotation for physical therapy school in Dothan, Alabama, which is one of 30 states that currently allows their PTs to utilize it as an intervention for physical therapy. In order to focus my direction and narrow my research topic, I generated the question, is dry needling an effective intervention for improving pain intensity and tolerance to daily activities for patients with myofascial neck pain? Therefore, the population I studied were patients with myofascial neck pain with the intervention of dry needling, with the outcome measured as the numerical pain rating scale or pain levels and activity tolerance using the Neck Disability Index. I found this topic to be very important and relevant as neck pain is a common referral and complaint, with as many as 50 to 80% of patients who develop neck pain experiencing chronic symptoms for up to 5 years following the onset of symptoms and utilizing 10 years of healthcare resources to help with the symptoms of the neck pain. Additionally, research has shown that although pain levels may improve over time, up to 50% of neck pain patients do not recover completely over a 1-year period. As a response to the high prevalence of these injuries, PTs have begun utilizing dry needling, where allowed, to potentially decrease symptoms and improve overall activity levels. Therefore, my critical appraisal reviewed research pertaining to this topic. As a result of my appraisal of the research, it was concluded that dry needling has minimal positive effect on pain improvement and/or activity tolerance based on the Neck Disability Index. Research utilized included 3 randomized controlled trials comparing 2 separate groups, with one always including dry needling. For example, in a study by Stephen et al. In the Journal of Orthopedic Sports Physical Therapy in 2020, he conducted a randomized controlled study between the use of dry needling combined with guideline-based PT for neck pain versus solely the use of guideline-based PT treatments for these patients. In this study, 116 patients were used between the ages of 18 and 65, and they must have had reported neck pain for at least 3 months. Baseline measurements were taken, as well as measurements following after 1 month and 3 months, all showing insignificance for the group that included dry needling as an intervention. Despite my findings and appraisal of this topic, I believe more research is necessary to make a definite conclusion of the effectiveness of dry needling for neck pain. All research articles used in randomized controlled trials disclose limitations in their own right on their studies. But the big limitation that I have seen for this topic is the limitation in use and allowance of dry needling in every state. Each state regulates and decides whether dry needling should be allowed, and as I mentioned earlier, only 30 states have at this time approved it to be used by licensed PTs. Thank you very much for your attention. Please feel free to leave a comment with any questions, concerns, or critiques, and I look forward to discussing more topics in the future. Thank you.